Good morning to you all. My name is Dr. Mathew Varghese. I am the consultant pediatrician at the KIMS Medical Center in Mohork. It's good to be back with yet another important and interesting topic in front of you all. My topic for the day is on flu. What is a flu? The flu is a very contagious influenza viral infection of the nose, throat and lungs. So how do children with flu present? Flu symptoms include a sudden onset of fever, usually around 101 degree Fahrenheit or 38.3 degrees Celsius, and chills, headache, body aches, being a lot more tired than usual, sore throat, dry hacking cough, stuffy runny nose, and some children even may vomit or even have loose stools and have diarrhea. So how do we treat flu? Treatment of flu includes use of salt water drops in the nostrils to relieve nasal congestion. Use a cool mist humidifier to increase air moisture. Put petroleum jelly on the skin under the nose to soothe the rawness. An older child above 4 years can have cough, and they can have cough syrups to relieve the throat pain. Consume plenty of extra non-caffeinated fluids like juice and water to prevent dehydration. Also have your child get plenty of sleep. If your child is uncomfortable with pain or fever, give them paracetamol or ibuprofen to relieve the pain and aches. Always consult your pediatrician if your child has severe flu symptoms, is having high fever or fever with a rash, is having trouble breathing or rapid breathing. Any type of bluish skin color, you have to consult your pediatrician. Also, if the child is not drinking enough fluids, seems very sleepy or even seems very confused. So coming next to the complications of flu. Children younger than 5 years of age, especially those younger than 2 years, are at high risk of serious life-related complications. Complications from flu among this children age group include pneumonia and dehydration, worsening of long-term medical problems like heart disease or asthma, brain dysfunction such as encephalopathy, sinus problems and ear infections. In the rare cases, even flu can lead to death. As we always say, prevention is always better than cure. So here are a few tips for avoiding the flu. The simplest thing you can do is wash your hands and teach your kids to do the same. Wash thoroughly and frequently with warm water and soap. Do this before leaving the bathroom, eating or touching your face. A good rule of thumb is to wash your hands for at least 20 seconds. Cover your cough with the crook of your elbow and teach your child to do the same. Stay at home from work or school if you are ill. Don't share drinking and eating utensils with others, especially if someone isn't feeling well. Don't pick up used tissues, but if you must, pick them with a clean paper and towel and wash your hands immediately after doing that. Avoid crowds during a flu epidemic. Last but not the least, the most effective way for flu prevention is vaccination or the flu shot. All people 6 months and older need a flu vaccine each year. Babies cannot get vaccinated until they are 6 months old. It is critical that people who live with or care for children, especially adults who are taking care of newborns or infants younger than 6 months, should get vaccinated with the flu vaccine. Traditionally, flu season peaks in February, then December and then in March. So the American Academy of Pediatrics recommends that the flu vaccine must be given annually to all children starting at 6 months of age. Children from 6 months to 8 years need two doses of vaccines given at least 4 weeks apart, and children 9 years and older need only one dose. So make sure you visit your nearest health center or our KIMS Medical Center Mohork for a child's flu shot. Thank you.